As we go through life, all of us at some point will need to access our local health and social care services. We may need a trip to the GP, a stay in hospital, some visits at home from the district nurse, or some support from a social worker. When we use these services, we just want it to work, and for the people who are caring for us to talk to each other so we get good quality care. Behind the scenes, the local services we receive are being delivered by lots of different organisations which all work in different ways. For example, our GPs work for an organisation called the Dorset Clinical Commissioning Group, while our hospital consultants and nurses work for our local NHS Foundation trusts, and our social workers and other community support teams work for our local council. Recently, our 8 local health and social care agencies have joined together to embark on a large piece of work they're calling Better Together. Better Together is about dramatically improving people's experiences of our health and social care system so we get less fragmented, more joined up services. This is also increasingly important at a time when many of these agencies are facing significant budget cuts. It's early days for the Better Together programme, but Access Dorset wanted to get in at the beginning to ask what this means for us and to see how we can have our say about what can be changed and improved for patients and service users. This is the first of a series of films where we will investigate the progress of Better Together. To begin with, we want to talk to Harry Capron, the Better Together programme director, about what these changes may mean for all of us. What does joined up care mean?
Basically, what we've had lots of feedback across the 8 participating agencies is that people experience very fragmented care. Some of the agencies, the joined up nature of care is not very effective, and often that can result in a kind of poor experience for service users or patients or carers. And what we're trying to do is improve the relationship between those agencies and therefore improve not only the experience for service users, patients or carers, but also improve the effectiveness of the services.
Tell us a bit about how you're planning to achieve this.
It's a very ambitious programme, one of the most ambitious programmes nationally. Huge scale of changes across 8 agencies. Clearly we can't do that all as one programme, so it's very much, some of the work will be taken and led by the agencies themselves, but we will try and provide the environment for joint working and joint planning. So one of the things we've set up, for example, is a sponsor board made up of the chief executives of the 8 agencies. So they now meet regularly to look at some of that joint planning.
What difference will this make to people using the health and social care system?
Well, one of the most important things is that people, the assessment of somebody's support requirements and their needs is done jointly across a number of different disciplines. So they're not having to tell their story over and over again. So some of that means sharing information between agencies, and also involving people directly in the planning and assessment of their needs. So it's very much about being person-centred or looking at tailoring that support to the individual. The other example is that often when somebody has an assessment or support plan, it can be quite difficult arranging that across the different agencies, so we want to jointly plan that together between the agencies and for the person to be much more control over the support they receive and actually trying to manage that themselves as far as possible.
How can people get involved and have their say?
Well, one of the things we've recognised is that people have already given a lot of feedback to what they're looking for. So we're not going to ask the same questions over and again. If people have already given us feedback, we need to act on it and do something about it. So, and a good example is that the health services have had the big ask questions, and we're taking the information from that and using that as well. But obviously people are going to want to comment on each of the different changes, so each of those projects and programs will have their own engagement work. And lastly, from my point of view, either through yourselves or directly through the Dorset View website, if people want to make comments to me, I'm more than happy to respond.
So these changes are in their very early stages, which gives us the chance to say what we think can be improved. What are your experiences of health and social care support? How do you think things could be joined up better? Please get in touch with Access Dorset and tell us about your experiences, and we'll make sure our voice is heard by the Better Together programme. We'll be back soon to see how the Better Together programme is progressing and to see in more detail what's changing as a result.